Morning, everyone. I'm Bill Kane. I'm the Basalt Mayor, and I'm accompanied today by Heath Harmon, who's our Eagle County Public Health Director. And we're here today to give you a quick update on affairs in the town of Basalt. We're going to begin with a discussion with Heath about the current status of COVID-19 and what we may expect and what we can do. And then I'm going to close with a quick update on activities that are taking place in town and action that you may see this summer. So I'd like to begin. Welcome, Heath, and appreciate you coming over. I guess let's just start. If you wouldn't mind, give us a quick update on how we're doing with COVID, incidence rate, hospitalizations, all those key metrics that you follow to see how we're doing with this disease.
Happy to. And first, thanks so much, Mayor Kane, for inviting me over. So in terms of disease incidence, got some good news for once to be able to share. I know in the Roaring Fork Valley over the past several weeks, and also in the Eagle River Valley, it's been a tough go. Let's face it, January was a relatively tough month for us. Everybody's been seeing high incidence rates, but I think actually what we've been able to see over the last week to 2 weeks is in all of our communities in Eagle County and then throughout the Roaring Fork Valley, we're actually seeing sustained decreases. So this is good news. We're seeing decreases also throughout the state of Colorado, decreases in hospitalizations. Again, that's some good news, but I would also highlight that as a state, we've got sort of two different stories going on here. So one, on the Front Range, we see very low disease incidence rates. So they're under 300 cases per 100,000, whereas up in many of our mountain communities, we're anywhere from 2 to 3 times higher than some of those Front Range communities right now. So we've still got a ways to go. It's still critically important that we maintain those precautions like the distance from one another and then wearing our masks. And I got to be honest with you, even when you're hanging around some of your close friends and or family members, if you're not part of the same household, but you're hanging out appropriately within those households, again, no more than 2 households and no more than 10 individuals, you still need to be wearing a face covering. At this point in time, there's the new variants out here that we've heard about from the UK, from South Africa. You know, we know that the UK variant is here in Colorado, and so it is expected that that will eventually become the predominant strain. So really important for us to take those precautions. The vaccine's here, that's great news, but we still got a long tunnel before we see the light of day. And so just wishing everybody to continue to take those precautions.
Great. So you mentioned we're seeing the UK variant. Is there anything we should be watching? Are we concerned about whether the vaccine will be effective in preventing COVID with this variation? What's the evidence there?
Yeah, it's a great question. It's probably the question we get most these days.
Yeah.
So a little bit of good news. What we understand right now, and again, there's still data that's coming in. And so as more and more data comes in, this will get more and more solid in terms of exactly how effective the vaccines are relative to these new variants. But thus far, we've seen more positive news, at least relative to the UK variant. And still, I think the data is out on the South African variant. So at this point in time, some of the preliminary data might indicate that it's a little bit less effective, this vaccine, compared to what the earlier circulating strains have been. But let's keep in mind, in terms of vaccines, the 2 vaccines that we have in Colorado right now are among the most effective for any vaccine, right? So 95% effective is wonderful. And I would also highlight that the great thing about the vaccines is that it's not just a single antibody that it helps your body or your immune system produce, but it's many hundreds of antibodies. And so it's never just one component of that virus. So regardless, we still will expect to see a level of effectiveness, but just if that's going to drop a little bit more, I think we'll understand that only as more data rolls in and as we understand those variants are in the community.
Good to know. Our last question for you is about vaccine. We've all been following the news. You know, we've had tales of disappointment from the federal level getting actual vaccine into the state. We seem to have the distribution network set up, but short on vaccine. The governor just announced that we're going to expand vaccination to those 65 and older, and school teachers, which I think we're all excited about. Schools are an amazingly important element in our community. So do you have your hand on that, finger on that pulse? Can you tell us kind of what the outlook may be? I guess really also for second vaccinations and whether we're going to be able to get 70 and over cleared out and be able to move forward with this 65 and over cohort?
Maybe I'll start with that piece right there.
Okay.
So 70 and above still remains the highest priority. So even for some communities where they're making deeper inroads in that population because they've had vaccine shipments more regularly, that's still going to be the highest priority. So the nice thing about the vaccination campaign is as we add new priority groups, if somebody's in an existing priority group but has yet to come in for a vaccination, they're still going to be top of the list. So 70 plus still top of the list, regardless of where you live in the state of Colorado. And so, yeah, let's face it, right now, as a nation, we could probably be doing a lot better in terms of the vaccine rollout. That said, our state is doing a much better job than most other states. As a local public health person and talking with Jordana Sabella from Pitkin County, we're both itching to get more vaccine into our community because we know that the interest is here and we know that we can do a really good job in getting that vaccine into the community as soon as it arrives here. So announced late last week, we did add some additional groups for a future priority group, and that's going to be eligible beginning February 8th. Again, this is all dependent on the vaccine availability in each community, but that's going to be teachers for pre-K through 12th grade. It's also going to include licensed childcare, and then this is also where we get to include the 65 to 69-year-olds. One of the things that I would just put out there is, again, when we are implementing the vaccine, we're trying to do this in a way that first and foremost is going to reduce severe disease and reduce death. So age is still probably one of the most critical factors in terms of the risk for severe disease and death. And so that's why we wanted to start with the 70 plus, and that's why we'll also be moving as quickly as we can to 65 to 69. We can expect more updates in the future, but I think for the remainder of February, this is probably where we're going to be focusing most of our time in these 3 new groups. And again, they'll be eligible beginning on February 8th. And one other thought, thinking about just community prevention efforts, it does take a community. So not only is it important what we do as individuals, but it's important what our businesses are doing around as well. And so still, both of our 2 public health agencies in Pitkin and Eagle County, we get a lot of complaints still about certain businesses that are not necessarily following through on some of the precautions. And I just want everybody to know that we're committed to being in the community to help ensure that education first, but also that those businesses are as safe as possible. And maybe this is a segue to some other things I'm sure you'll want to talk about. I can't tell you how proud I am to live in communities where actually towns and counties are committing dollars to help the businesses get through this tough time. So keep it up, everybody. We really appreciate those efforts.
Great. And before we let him go, I just want to put a plug in for Eagle County. We can't imagine a better, more competent unit of local government or agency to work with. These guys have been on top of this outbreak as closely as you could possibly expect. So we've had excellent communications, excellent follow-up. We're in a weird geographic arrangement, far away from the county seat, but we see them frequently and often, and I think they've done a whale of a good job helping us navigate through these really tricky times from a regulatory standpoint. So we really appreciate your efforts.
Thank you for that. Really appreciate hearing that.
I would begin by saying we are acutely aware of the strains that COVID have created, both financially and in the health and human service area for our community. And as you'll see here in a minute, we've worked hard to address the broad reach that the disease has created for our community and the state. So I'm going to comment on activities that are underway that really fall into 3 categories: financial assistance, health and human services, and community infrastructure. So to begin with, I just wanted to comment that the town has finished reporting on our last round of CARES money, and we were very successful in getting money out through our direct business assistance and the Basalt Bucks program. The town would also like to thank Eagle County. We were successful in getting $500,000 of direct financial assistance from Eagle County, and we had about 34 local businesses that qualified for grants averaging about $15,000 each. And these are not loans, these are direct grants and assistance programs to help our businesses weather through the winter, get to summer, and to hopefully happier times and more prosperous times this summer. There's another program that is coming down the pike that we should be aware of. Pitkin County has also put together about $1.2 million, $1.3 million for business assistance. And you can find out about this through the business grant program through the Aspen Community Foundation. So go on ACF and take a look at their business granting programs. And we think we have about $1,280,000 has been appropriated. So to move on to Health and Human Services, you may have seen in the news that the town has been the beneficiary of a new tobacco tax. And I think, hopefully wisely, we are taking that revenue and turning it back into direct health services. We have two programs that we are supporting with tobacco tax proceeds. One is we are going to support full-time counselor in the Basalt Elementary School. This is $100,000 a year for 3 years. And on top of that, then we're also going to support the Aspen Hope Center with direct support in our community. And that will be funded with $150,000 for 3 years. So we couldn't think of a better use for our tobacco tax proceeds. And during these difficult times, we are hopeful that these services will be of assistance to the community. The final thing I would comment on is that it's now February. It'll be spring pretty soon. And we're going to see a lot of construction activity in the community, and a lot of it's underway already that you can see. But we want to make sure that everyone understands that everything you're going to see is well within our urban growth boundary, is completely consistent with local zoning. Everything has been vetted through an extremely exhaustive land use process, but this is kind of the growth and development which is envisioned in our comprehensive plan. So on our side for the town, we have three community facilities, infrastructure investments, that we're calling the 3 Ps. So we have the pool, we have the park, and we have public works. And the pool is being funded for a little over $3 million to create a really fun set of activities for kids, a robot pool. We're going to revamp the locker rooms, and we're going to make this a state-of-the-art community pool facility. This is costing, as I mentioned, $3 million. We funded this with certificates of participation, and we're able to borrow money at 1.3%, which is pretty remarkable. In addition to that, we have the River Park right behind me, which will get underway this summer. This will be phase one. This is going to take multiple years to get all of the facilities in place, but you'll see a lot of action this summer. We're going to open up access and make landscape improvements and create more activities on our park front. We have purchased a crucial piece of land located in the Mid-Valley that will allow our public works guys to service the Willits area directly from the Mid-Valley, and we've closed on that land and are now underway cleaning up and getting ready to build our public works facilities. So then other things you'll see in the community, Takaw is nearing completion out at Willits, 240-seat beautiful cabaret theater and wonderful indoor space. The Stedman Center, if you've been out there recently, you'll notice that foundation walls are going up, and this will be a state-of-the-art orthopedic center with 4 surgical suites. Skiko Housing Building is nearing completion. We're on the final step of completing all the approvals needed for Stotts Mill project, which will be a big development project on Southside Drive out near the high school. We have 12 units of rental housing that's in the review process before Town Council right now on Emma Road. That's out by Harry Teague's Lofts building. And then the private sector portion of the River Park will be coming out of the ground this summer as well. So a lot of activity, a lot of change underway. We are, of course, hopeful that these are all changes for the good and are all geared to improve Basalt and make it as enjoyable and healthy a place to live as possible. So we thank you for looking in this morning. If you have any questions on these projects or any others, don't hesitate to contact me or Ryan Mahoney, our town manager, Town Hall, 101 Midland. And thanks, everybody. It is now February 2nd, and not that I'm counting days, but I think spring's about 58 days away. So thanks, everyone.